In this video, I'm going to talk about my experience with LASIK, why I decided to get the procedure done, what my research process looked like, and I'll also get into what the pre-surgery, the surgery day, and post-surgery care look like. And also in this video, I'm going to answer as many of the frequently asked questions about the LASIK procedure in this particular video. So stay tuned. Hi everyone, my name is Donald. I'm an entrepreneur, investor, and my mission in life today is to optimize my life for health, wealth, and happiness. Now, before I get into this video, it really means a lot to me if you can help support the channel by subscribing. Be sure to hit that notification bell, like, comment, and subscribe. And I appreciate you all. And now back to the video. I'd like to preface this video as well as any of the health related videos that I'm not a doctor, and so be sure to consult with your healthcare professional, doctor, physician, to consult with anything related to your health. So first, let's explain what LASIK is. Essentially, it's a procedure that's done that utilizes laser to remove a thin layer of the corneal tissue within the eye, allowing light rays to be clearly focused on the retina. So it does cause the cornea to have a thinner layer, and it's essentially a way to improve your eyesight to near perfect or sometimes 20/20 and even better vision. And it's for those who don't want to be wearing contact lens on a daily basis because it could be bothersome to them. They don't want to wear glasses anymore, and it's essentially a way to kind of improve your eyesight. And yeah, that's essentially what LASIK is in kind of simple terms, which provides refraction to improve the eyesight or correct vision. So first of all, I'll talk about why I decided to get the procedure done. And so for myself, I made it a mandate this year to kind of improve my health and invest into my health. And so one of the things that you know bugs me and a lot of other people is to have to wake up in the morning and put on your glasses, walk over to the washroom, and put in your contact lens. And people that wear contact lens, we all know that there's issues of kind of pain and dryness over the course of the hours of the day as you continue to wear it throughout the day. And I thought that it'd be a good way to kind of level up, and not thinking too much of it. I did kind of go through the typical research process. I googled LASIK, how much does it cost, where can you get it done, what are the good clinics around town that provides this particular procedure. I also considered the ratings reviews of the various clinics, and I also went down the YouTube rabbit hole to really understand what the process looked like, and look at other people's journeys that took the path of wanting to improve the eyesight through LASIK. So I did preliminary research online, as most people would do, and I kind of got a general sense of what the cost was, how long it would take, and also what the procedure actually entailed. Was it painful? What was the aftercare like? And so I landed on a company called LASIK MD, and maybe another two, but LASIK MD was definitely seemed like the biggest. They had a national presence all across Canada. They may even have some presence in the U.S. Not entirely sure, but they had really good reviews, and looked at some of the most recent reviews on Google, and it also tried to look at people that had the lowest provided the lowest scores, and saw why they gave such low scores. And so I took that all into consideration, and the way that I chose this particular clinic was that it seemed to have the most experience doing the procedure, which I wanted. Obviously, if someone's going to be utilizing laser and cutting a thin layer within the eye, that you want to do it by someone who's completely experienced doing it, and So I booked an appointment, and on the first appointment, it essentially did a bunch of tests, really understand my, where I'm at with respect to my eyesight, things like dryness. I had, the thickness of your, cornea, things like that. Typically, those that have thinner cornea or a thinner lens, and also those that had, dryness within the eyes, that they would usually have more pronounced kind of side effects after doing the procedure. And so I was definitely well aware of all the risks, and that's the thing that they try to establish. They want to identify if you'd be a good candidate to receive the procedure. The surgeon will only want to do the procedure if they're confident that they can actually improve your eyesight, right? Because you're spending a lot of money doing it, and also too, they want to make sure that you're aware of all the risks, so then you sign on basically the contracts that you're well aware of the conditions, and you still okay to go through with the procedure, and so that kind of covers them legally. And so, but I think it's a really good thing to be able to fully understand what your current situation is, what are the risks, so then you're aware of how to deal with any side effects if you were to have any. And yeah, it was just a really great experience all around. And so essentially after that meeting, signing a bunch of forms and doing a lot of tests, they'll notify the surgeons, and if one picks it up, they'll let you know whether or not they let me know whether or not I'd be a good candidate. Now for myself, I had thinner kind of cornea, and so they essentially were on the fence between LASIK or something called PRK, which is another type of procedure. Both kind of have the same result, improved eyesight. However, the the length of time to recover is much longer with the PRK. It's a very slightly variation of the LASIK surgery. It's not the same thing, but it will result in the same result. And I believe that from what I remembered them telling me was that it would take about a week to recover at least, and I wouldn't have good eyesight for at least a week, so I'd actually have to adjust my left cornea if I were to go through with the PRK. The LASIK, however, it'd be a much quicker recovery. Essentially, after the procedure is done, my eyesight would be returning within a matter of an hour or a few hours that same day. And so, of course, I was hoping that I would be able to get the LASIK, and even at that point, I was still on the fence. I think that if they had come back to me with PRK, I probably wouldn't have done it, but I got a call back saying that I'm actually a candidate for LASIK. And of course, I would have the continued dry eyes, but I've had dry eyes for years now, and since I can even remember. And so it's something that I knew that I can live with. I just have to make sure that I have, utilize eye drops every now and then. But the quality of life of being able to wake up in the morning not having to wear my glasses and contact lens and wake up with perfect eyesight each and every day was definitely something that I was keen on doing. And so I think that once I got assurance from the doctor that I'm actually a candidate for LASIK, that I was more serious about doing it. And even at that, there would also be a possibility that once I get on the day of the surgery and they find that the LASIK is just not worth it, they will actually have to cancel the surgery and then rebook me for the PRK. And so there was that also to consider. So the cost of LASIK was about $4,290 plus an additional $50 to get kind of lifetime insurance. So it's essentially $4,340 in total, I believe. And so, but just make sure that you consult with your clinic and ask them for the estimate for the price. And the reason why I decided to get that lifetime insurance was, if there were anything to go wrong with the, after getting the procedure, that you can always go back to get things fixed. And it's pretty much lifetime guarantee, and that I think that $50 was definitely worth that. And you just have to make sure that you go to the regular checkups. And so after you get the procedure done, you'll have a follow up the next day, a week after, and then it'll be, I believe, every year after that. And so you just have to make sure that you go to those follow ups, because if you're not getting follow up, then it seems like you're not doing what you need to do to ensure that your eye health is maintained after getting the procedure done. So I think that it's definitely expensive, in terms of a procedure cost, medical procedure cost, but the quality of life that I had received. So, kind of long story short, with respect to the results, I actually love my result from the LASIK. I actually had eyesight that's actually better than 2020. I believe it's 1520, I believe, and so I actually had 2015, which is better than 2020 vision, and so it's just amazing. I can recall, after getting procedure done, and when my eyesight starting to come back, it's amazing. It was like crystal clear. It was awesome, and so for me, I had obviously it was a really good, experience overall, and so ultimately you have to decide whether or not the risks and the procedure is going to be good for you, because obviously everybody's body is different, everybody's eyes are different, and so you know other people may have different varying results, right? And so how long was the procedure? Now, leading up to the procedure itself, we booked the procedure, and on the day of, you pretty much have to book the whole day, because even the morning of, you're still doing tests to kind of confirm and verify, because things could change the day after, right? After doing the initial kind of tests, right? And so you want to make sure that you're still a good candidate before doing the actual procedure. On the day of the procedure, like I said, yeah, you're kind of waiting in the waiting room all day. So make sure that you're kind of, prepare for that. Bring a book or something like that, And they do recommend that, you don't wear contact lens for at least a week or something like that. Depending on if it's a hard contact lens, I'm not sure what that is, but yeah, you would not want to wear that for a long period of time. And so I think the idea is, so then you give the surgeon the condition of your eye when it's the most healthiest and the best case scenario, right? And so that's kind of the prep, right? And there's a few other things too. Yeah, don't take a flight the day before. Don't drink alcohol. Things like that. Don't rub your eyes. Keep it, keep things around your eyes clean at all times, and so things like that. But yeah, and so they would, when it's time for you to actually get the surgery done, you're kind of, for me, I was kind of brought into the kind of pre-surgery room, and one of the technicians actually, would put in numbing eye drops, and it's a weird feeling. It essentially numbs your eyes, and when you walk into the surgery room, you get greeted by the nurse, assistant, and the surgeon, and yeah, you lie down, and essentially they prep your eyes, your face, to make sure that your face is as steady as possible, and they inserted, I'm not sure exactly what that part of the surgery actually looked like, but you can actually feel it. You can feel pressure on the eyes when they're kind of positioning it in place for the laser. The key thing is to make sure your eyes are as straight on as possible, and the doctor will kind of walk you through that process. And I remember seeing a bunch of like green and red lights, kind of, it seemed like a Tron setting, and then yeah, and then I remember seeing all of a sudden all white. It's quite weird. And so you do one eye and then you do the other eye. You know, when you see kind of all white, it's kind of scary. You know, you're like, oh, did I just lose my eyesight? You know, and so yeah, I believe that the whole procedure was, you know, anywhere between like, you know, 15 to 30 minutes or so. You know, and but the majority of the time is just kind of preparing your eyes. You know, once it's done, they give you a pair of sunglasses. You know, make sure that your vitals are good. You know, they do take your vitals before and after, make sure that everything is good. Then you go back to the waiting room and you know you're kind of anxiously waiting for your eyesight to come back, and after a certain period of time you do a final kind of check to make sure that the eyes, the flap, you know, after they make the incision and then you know do the laser procedure and then they close the flap, that is starting to heal properly. And yeah, and so everything looked good. Made a follow-up appointment the next morning, got there the next morning and checked my eyesight. I got 2015, I believe, eyesight, which is better than 2020 perfect vision. Incredible. And so after the first day, you know, you there's, you know, quite a bit of kind of rigorous kind of post care things that you need to do. You need to put, I believe, like 3 or 4 sets of eye drops every like 2 or 3 hours or so, kind of throughout the whole day. And you know, you want to, I think it's like antibiotics to prevent any type of infection, eye drops, and a few others. And so it took about like, you know, several minutes to actually go through the whole eye drops. The next day after that, you kind of go through the same process. I believe that you do that for about 5 days. And so it is quite a rigorous process. But the good thing is you have your eyesight back. You may notice that your eyesight is really sensitive to light. And so you're actually wearing sunglasses throughout the whole day. You know, you want to kind of prevent the sunlight outside, you know, to make sure that the eyes are healing as best as possible, right? You actually wear the goggles, sunglasses at night to prevent your, you know, from kind of rubbing your eye on your eyes, which could, you know, affect the healing process. And so, yeah, I believe that you kind of want to prevent like having water drip into the eyes. So like the showering that first night wasn't possible. And so, but you know, slowly but surely things get better. And it is a bit of a pain to kind of go through the, not painful, but the process of having to put in the eye drops, whatever. But once that's done, everything's fine. And yeah, you just want to make sure that your eyes are protected as much as possible. In another video, I'll go more depth of, you know, the actual eye drops and also the care that I did to make sure that I healed properly. And yeah, now I would say that it's probably one of the best investments that I made in a long time, in that I invested in myself, for one. Number two, I have perfect eyesight. It's incredible feeling, right? And so, you know, it's pretty awesome. And also go into more about things that you can't really do for the, you know, first month, 3 months, and up to the year. Like, you know, they recommend that you not like go swimming, you know, things like that, because you may get bacteria or and whatnot. You know, the swimming pool can be quite dirty, or the ocean and whatnot, and so you just want to be cognizant of ensuring that your eyesight is clean as possible, right? And so for me, in terms of side effects, I only had dry eyes, but I've always had dry eyes, right? And so it was no big deal. I just kind of put in eye drops first thing in the morning after I brush my teeth, wash my face and brush my teeth, and also like maybe midway through the day if I have dry eyes, if I'm feeling it. But yeah, for the most part, everything is okay. I did notice a bit of sensitivity for sure within, you know, going outside, you know, went on a sunny day, but you know, you just need to wear sunglasses and you should be fine. So I read online that it takes up to a whole year for your eyes to fully really be healed properly. So I definitely don't want to take any chances and risk, you know, impacting that healing process. So I'm just gonna follow the general guides, you know, to ensure that my eyesight is, you know, is always perfect, and I protect my investment of the eye surgery, right? So I want to answer the question like why I decided to do it now. As mentioned, I decided to really invest into my health and my well-being, and I thought that having perfect eyesight is like superhero power, you know. And so I thought that would be pretty awesome to have. And I did think about it a while, and I did talk to a few other people that had it done, and they had good experiences. And so, when you're talking to people that have good experiences, then it's always good. I try to stay away from people who had, negative, you know, journey. I just didn't want to scare myself. I wanted to hear the risks from the healthcare professionals themselves, because I'm not sure how people, take their aftercare seriously, and so everybody's different, right? And so I know for myself, I'm very diligent. When I have a set of rules to follow, I follow them. I follow them to a T as much as possible. I would say, to answer the question, when is the best time of the year to get it done? I would say probably definitely do it before summertime, because summertime is usually when it's really sunny, and the sun does a lot of damage to the eyes, right? And so you want to make sure that you protect your eyes. Right now it's summer time for me. I got my LASIK done almost 2 months ago now, and so I just need to make sure that I wear sunglasses when I'm outside, have UV protection. But yeah, I would say maybe springtime or even wintertime may be ideal. Even fall. Right after the summertime when it's not as sunny all the time, right? And so the question is, what I was hoping to achieve with LASIK. Yeah, obviously I wanted to have at least 20/20 eye vision. I wanted to be able to have a better quality of life where I don't have to like wear contact lens. I'm quite active. I like to play sports a lot, and I enjoy swimming, and so I just didn't want to have to wear contact lens all the time, and it gets really dry, and kind of painful, and you have to constantly take it in and take it out. Interestingly enough, I actually got new contact lens, a few, I think, weeks before actually doing LASIK, because when I had to buy a new set of contact lens, I didn't really think about LASIK until maybe a few days or a few weeks after getting my new set of contact lens, right? And so, but it's all good, no big deal. I'm at the end of the day, I'm really happy to get LASIK done. What was my research process like for the LASIK procedure? Yeah, as mentioned, I checked online. I was searching out for the clinic that had the best reviews, the most recent reviews, the most reviews, and also who had the best kind of facilities and technologies and experience doing the procedure. What were the things that I considered when choosing the clinic? Yeah, experience, the reviews, the year's experience, and the technologies, and just a company that really cares about their patients' kind of results. So what was discovered during my initial consultation? Yeah, they went over all the risks that could possibly happen after getting LASIK done. What is the alternate solution if LASIK wasn't ideal for me? We also looked at all aspects of my eyes, the health of the eyes, conditions of the eyes. If I had dry eyes also, what was my eyesight like, things like that, vision tests. And so they want to really, like I said, they want to make sure that you are a good candidate, you are aware of all the risks, and what every step of the way looks like, before the surgery, the day of the surgery, and afterwards. And so it was just a really good experience all around, for sure. So what are the risks? The risks, yeah, for sure. Like, I started to look at some of the negative reviews afterwards, after getting procedure done. But yeah, it seemed like some people had issues with, the sensitivity to the light was really harsh. Some people didn't heal properly, things like that. And so with any procedure, there's a risk, right? And, you just need to try to be as educated as possible to learn as much as you can so you know how to deal with any situation. Why there's so much paperwork. And so you'll find throughout the whole process, from the day of the initial consultation, there's a ton of paperwork that you go through, and a lot of it is to kind of cover the clinic legally, so then you're aware of all the risks, and then you still sign on the dotted line, things like that. But it's also to ensure that it protects you, that that and you're confident that the clinic did everything that they needed to do to ensure that you're fully aware of all aspects of the procedure, right? And so as mentioned, there's an alternate procedure to LASIK. It's called PRK, and yeah, I was really pleased that I didn't have to do the PRK because the length of time for recovery was much longer, and just based on my kind of schedule, it didn't really allow for me to incorporate that into my life. LASIK is much quicker in terms of the recovery time, and so I was really pleased that I was a good candidate for LASIK, and I actually you know was able to do the whole procedure done by LASIK. My mindset throughout the whole process, I was really intrigued by how professional everybody was. I was also intrigued by the whole process. They really took care of you know any of the fears that you may have had leading up to the procedure. you know Now I should also mention that with the pricing, I believe that they allow people to finance it, so you can actually make somewhat monthly payments. Also, you don't have to pay everything all at once to help you pay for the procedure. I believe that most insurances don't cover LASIK. I tried to look that up, and I think that there's some big insurance companies that do incorporate it, but it really depends on your company, your workplace, that if it does cover, right? And so that's something that you want to look at as well. But my mindset, like I said, it was really positive. I'm really I try to have a positive mindset about everything, and usually good things happen when you have a good mindset. And so the next question was I ever scared of the process or procedure? I was never scared. I think that because you know the healthcare professionals at the clinic were so professional, and they provided as much information as possible, answered all of my questions, that I felt confident that they would do a good job overall. And even leading up to on the day of the surgery, I wasn't really scared. I did try to read, like, is it painful? That's something that would scare a lot of people, but I read that it's not painful at all. you know and it wasn't. It's just, you could definitely feel it when they kind of put, I'm not sure what to put, whatever to stabilize your eyes during the procedure. Like, you can feel the pressure on your eyes, but yeah, I was never scared. I think that overall I was definitely hoping, obviously, for a really good result, and I'm glad that I had a good result overall. So I remember, after the procedure was done, that I thanked the doctor, and because I can tell that he was happy about the procedure as well. And when you see your doctor giving you the A-OK, it just kind of really makes you feel more relieved, and so yeah, it was just really good overall experience, and I was never scared. I don't think. Maybe a few minutes beforehand, I may have been a little bit worried, like, oh, what happens, but what if? But you're just trying to have a mentality like, this is gonna go really well, and be positive. And because I think if you're stressed, increases cortisol, and just puts your body in a not a good state, and that could, I'm not sure, it may impact the result, right? And so you want to have a clear and positive mindset for sure. Pre-surgery, yeah, I just want to really ensure that I follow the rules, that I go to the surgery, day of the surgery, as prepared as possible. I had extra jacket, if in case I got cold during the wait, and also I had some books to read, things like that. And make sure that I don't wear a contact lens at least a week before, things like that. So day of the surgery, everything was good, and post surgery, just follow all the directions of the rules. They gave me like a timeline of how, like, following the times that I have to do use each of the eye drops throughout the day. Just follow that, no big deal, right? And everything would be fine, right? The results, yeah, like I said, for me it was really positive, and so if you decide, I hope that you also have a good positive journey with respect to LASIK. Follow-ups, I believe that, yeah, there was a follow-up after the surgery, the day after surgery, the morning of, to make sure that the flaps are healing properly, and also that your eyesight, they also check your vision and to make sure that everything's healing properly. And I believe that there was a follow-up a week after, and yeah, everything looked good. I should also mention here that one of the rules also was that on the day of the surgery, you actually have to have someone help to take you home, meaning that you actually have to make sure you schedule, you contact someone that you trust and can actually, if it's during the day, take time off work if they're working to meet with you on the day of surgery, because the the doctors, they don't want you to go home alone, because if your eyesight is not perfect, then it could impact, it may not be safe for you to go home alone. And so just on the safe side, you want to make sure that you have someone, prepare someone to actually be at the office, you know on the day of, so then they can help to take you home safely. And also, wanted to mention that when you're going home, yeah, you want to make sure you have your sunglasses on, A, to protect you from the sunlight, but also B, to protect your eyesight from, if there's wind, that there's no dust blowing through and hitting your eye. You just want to make sure that is, you don't want anything getting into your eyes, dust, things like that, dirt, from going home. And so ideally you'll have someone drive you home, right? And so that would be the best case scenario. So as mentioned, yeah, I believe that I'm on my second month of finishing the LASIK procedure. I just checked my calendar, and it's actually I'm at almost at the 3 month mark, and so it's almost been 3 months since getting the procedure done, and so yeah, so far so good, and I would say the post care, just follow the guidelines, like I said. At this point, all I'm doing is, like I said, adding eye drops. If you don't have issues with dry eyes, then yeah, you may not even need that, right? And so I make sure that I um, protect my eyes if I'm in the shower. I make sure that I don't have any, like, dirt or anything like that getting to my eyes. I wear sunglasses when I'm going outside into the sun, and yeah, you just want to protect your eyes as much as possible. I remember there being a bin also, like, for those that want to get rid of their glasses, and so I had a nice set of frames, and so what I did also, in addition to getting the contact lens, like I said, renewed before getting LASIK, before knowing that I was going to get LASIK, I believe that I also had the lens updated, because when I did my vision test, my eyesight changed slightly, like, before getting the LASIK, and so after the surgery, I actually went back to my optician store and got them to just put in, like, regular, like, UV protection, kind of non-prescription lens into my frames, because I had a nice set of Ray-Ban frames, right? And so so I actually wore that for the first few weeks, actually, after getting procedure done, to protect anything from hitting my eyes. So I actually wore glasses, non-prescription glasses, for several weeks, I believe. And so I'm gonna answer a few more frequently asked questions, FAQs. And so one of the questions is LASIK good for your eyes? It really depends. Yeah, if you have good result at getting improved eyesight, after getting the procedure done, I think it's good. Is it painful? For me, it wasn't painful, and I think for the most part, in general, it's not painful. They put numbing drops into your eyes, and yeah, the only thing that I felt was a little bit of pressure. And when they're kind of pushing, using the lasers, that you can see, like, really cool laser light show. It's pretty interesting. And then you see a bunch of white all of a sudden. So that was kind of interesting. So the next question is, how long after getting the LASIK procedure can you get 20/20 vision? For me, it was immediately after, like, probably within the first hour. When I kind of peeked through my sunglasses, I actually saw that everything was coming through. I'm not sure it was 20/20 at that point, but when I got my vision tested the next morning on my follow-up day, it was actually better than 20/20. And so for me, it was immediate. I believe that if you're to get the PRK, it's longer. And so definitely consult with your eye doctor about that for sure. Next question is, are you awake during the LASIK procedure? Yes, you're awake. And, essentially your eyes have to be open during the procedure. And so, but the doctor kind of walk you through the whole process, and the assistant is there also to make sure that you're comfortable and you're doing well during the procedure. Next question is, what is the best age for LASIK? That I'm not sure exactly. I know that as you get older, it may not be as good. I think that when you reach your 40s, your eyesight definitely changes substantially, then maybe not substantially, but it will definitely change in terms of like, you know, people may start needing reading glasses. It's just part of aging, right? And so, you know, your eyesight may get worse as you get older. You know, a lot of people are in front of their iPhones or their smartphones, their computers. They, you know, may also play a lot of video games or watch a lot of TV. You know, things like that could impact your eyesight. Being out in the sun, you know, may impact your eyesight. With, you know, and so I think another common thing, like I said, is, you know, people requiring reading glasses, and so people cannot read too far away or too close, and so they may need to get some sort of adjustment corrective lens. I think that if you're too young, may not be the best. You know, if your eyes are still developing. You know, I did. I don't think that there's an actual age limit. I think that it depends from case to case. That's why they do all those testings to make sure that you're a good candidate. I did see an older gentleman on the day of my surgery as well, getting a procedure done, and so yeah, everybody is different from, you know, it'll vary from case to case. So I don't think that there's an actual like age that is best for. When I checked online, it said that ages 25 to 40 is the best time when surgeons will agree to doing the procedures on the patient. 25 is usually the age where your eyes somewhat stabilize, and so yeah, 25 to 40 it seems to be the ideal age for LASIK. But like I said, everybody's case is different. So if you're interested, definitely go in for a free consultation. It's free, right? And yeah, just make sure that you get tested on all aspects, you know, of your eyesight, vision condition, all that stuff. And the surgeon, like I said, will make the decision whether or not you'll be a candidate for LASIK or PRK, or may not even be good for the procedures altogether, right? So next question is, do you still wear glasses after LASIK? No, you don't need it, because yeah, like I said, your eyes are better than 20/20, so you don't need corrective contact lens, corrective glasses. So you just got to make sure that you wear sunglasses. You know, that may change over time when the sensitivity starts to decrease. Also, too, you know, like for me, I decided to wear non-prescription glasses just to protect my eyes from dust or anything getting to my eyes the first few weeks after getting the procedure done. Okay, final question. So was it worth it? Huge yes. For me, like I said, I had really good positive results. I had, you know, hopefully I still have it. 2015, better than 20/20 vision, perfect vision. And it's just, for me, an improved quality of life. Not having to fumble around with contact lens, not having to, you know, get up in the morning and search for my glasses. And so for me, it was really good. Of course, if if my eyesight wasn't as good and the procedure wasn't a success, then I would say otherwise. But yeah, for me overall, everything was perfect, and I think it's one of the best investments that I made for myself, and I'm really happy that I've gone through with it. So I hope this video helps answer a lot of questions that you may have if you're early on in your research process of getting a LASIK procedure. Like I said, always consult with your doctor and your physician, healthcare professional, to get an actual assessment, you know, done. And in future videos, I'll try to go more in depth of the procedures, the aftercare, you know, eye drop procedures and processes, and just kind of document more of the experiences that I had with LASIK. And yeah, with that said, thank you so much for watching. I really appreciate it. If you're interested in videos like this and topics about improving your health and just kind of overall, you know, leveling up with respect to health, wealth, and happiness, definitely feel free to subscribe to my videos channel. Definitely feel free to subscribe to my channel. Be sure to hit that notification bell to get notified of all my new videos going forward. And yeah, whatever decision that you make, I hope that you do your research and you guys have good result also. And yeah, I'm really proud of anybody who decides to, you know, invest into their health and level up. Yeah, and I truly believe that health is wealth, you know. And so yeah, thanks again for watching my video. Until next time, take care everybody. Bye now.